Let's clear the air around health savings accounts. Now, HSAs are clearly the most effective way to save for healthcare, but the question is, can HSAs help you save on healthcare? HSA adoption has certainly increased in the last decade, but employers have found that employees are more hesitant to enroll in high-deductible health plans with HSAs than they had presumed. Why leave such impressive savings and tax benefits on the table? Chances are these employees have been exposed to all the HSA myths that are floating around. So let's debunk them and set healthcare consumers on the pathway to healthcare reform. Myth number 1, high deductible plans equals more money out of your pocket. HSAs are only available to those with high deductible health plans, but believe it or not, this is a win-win. Economist Benjamin Handel found that when offered the choice between a high deductible and a low deductible health plan, most Americans choose the low deductible. Well, at first glance, low deductible sounds more appealing, right? Many people believe that the coverage on low deductible plans kicks in sooner. However, as inviting as low deductible may sound, it's important to remember that low deductible health plans go hand in hand with high premiums. So when you pay your deductible, you're paying for healthcare that you actually receive. But when you pay for premiums, you're paying for what-if costs. What if I go to the ER? What if I catch bubonic plague? I'd better fork out a bunch of money each month so I know I'll be covered in case something happens. But honestly, how often do you actually go to the doctor? Does it really make sense to pay high premiums when you go to the doctor's office maybe twice a year? So what if you were able to pay for what you needed and kept or saved in your HSA what you didn't spend? On top of that, once the deductible is met, high deductible health plans typically offer better coverage than copay plans. According to the New York Times, quote, economists have a term for a situation like this, where one option is better than another under any circumstances, dominance. And that's what we see in many workplaces. The cheaper healthcare plan at every level of medical spending often has a higher deductible. Close quote. So, long story short, though it may feel like you're paying more with a high deductible health plan at the beginning of the year, you'll save significantly through lower premiums and increased coverage and have money to save in your health savings account. Myth number 2, HSA money disappears after employment ends. Maybe you're hesitant to enroll in a HSA because you don't see your current employer as long-term. You're worried about the money you contribute toward your HSA going to waste. Well, good news. HSAs are 100% transferable from one employer to the next, and the funds roll over from year to year. It's all your money wherever you go and whoever you work for, period. Which brings us to myth number 3. A health savings account qualified plan means less benefits. Less benefits? That couldn't be more wrong. An HSA qualified plan is the only plan that allows for long-term savings. As stated previously, funds are transferable and they roll over from year to year. HSAs offer triple tax advantage: tax-free contributions, tax-free growth, tax-free withdrawals for qualified medical expenses, and yes, these qualified expenses include optical and dental. Once an HSA owner turns 65, HSA funds can be used for non-medical expenses, but then they're just taxed normally. Final fact of good news, HSA funds can be invested, which is an invaluable way to take advantage of their tax-free growth. Maximizing your yearly contributions and investing can set you up with quite a little nest egg for retirement. We'd love to see a copay plan do that. Now, to find out the truth about more HSA myths, we've got another article just right here below. Click on the link. We hope this clears the air around health savings accounts and any other myths. Thank you so much for listening.